Did you know that daily hygiene habits, which many seniors still maintain, could be hiding serious health issues? Just a few simple mistakes in self-care can lead to dangerous conditions that many people are unaware of. In fact, up to 60% of seniors don't realize they're facing these issues every single day. What's even more concerning is that these mistakes don't just affect your health. They can also reduce your quality of life and independence. But what you're about to hear is even more important. These seemingly harmless hygiene habits could be directly impacting your health. In today's video, I'll share with you the 7 hygiene mistakes that doctors easily spot in elderly patients and how to fix them immediately to protect your health and prevent dangerous conditions. Are you dealing with any hygiene-related health issues? Feel free to leave a comment below and share your experiences. If you don't make changes today, these problems could get worse. Mistake 1. Neglecting oral hygiene. Neglecting proper oral care doesn't just lead to bad breath or tooth loss. It can also contribute to heart disease, stroke, and even dementia. Geriatric specialists at Harvard Medical School have proven that bacteria from untreated gum disease can enter your bloodstream and cause dangerous cardiovascular issues. Their research shows that seniors with poor oral hygiene are 3 times more likely to develop cardiovascular problems than those who maintain proper dental care. A prime example is the story of Sylvia, a 68-year-old retired teacher from Oregon. Sylvia ignored her bleeding gums for months, thinking it was a normal part of aging. However, during a routine checkup, her cardiologist discovered severe inflammation in her heart valves caused by bacteria from her mouth that had traveled through her bloodstream. The doctor warned that if she had waited just a few more months, the damage might have been irreversible. How to fix it? First, if your toothbrush is old or worn out, replace it immediately. Switching to an electric toothbrush is a great option, as it can remove 62% more plaque than a manual toothbrush, according to research from the University of Pennsylvania. Make sure to brush twice a day for at least 2 minutes each time, and use a timer if needed. Floss every night and never skip regular checkups, even if you wear dentures. Mistake 2. Infrequent bathing and skincare. As we age, many people tend to reduce the frequency of bathing, thinking it's no longer necessary or fearing that it may dry out the skin. However, our skin is the largest organ in our body and can reveal serious health issues before other symptoms appear. Dermatologists from Mayo Clinic have pointed out that reduced bathing frequency in seniors can often hide early signs of conditions like diabetes, liver disease, and cardiovascular issues. Their research shows that nearly 40% of undiagnosed health conditions in elderly individuals could have been detected earlier with proper attention to skin care. Take the case of Clarence, a 77-year-old retired postal worker from Michigan. Clarence thought that bathing once a week was enough, especially during the winter months when his skin felt dry. "I didn't want to dry out my skin," he explained. However, during a routine health check, his doctor noticed unusual skin discoloration, which led to the discovery of early-stage kidney disease. Infrequent bathing had masked a critical symptom that could have been detected much earlier. How to fix it? Set up a regular bathing routine at least 3 times a week, even if you're not particularly active. Use a mild, fragrance-free soap to avoid over-drying your skin. After bathing, apply moisturizer while your skin is still slightly damp to lock in hydration. Most importantly, regularly inspect your skin for any unusual changes in color, texture, or sensation. If you notice dry, itchy patches or any areas of discoloration, don't dismiss them as just a normal part of aging. They could be warning signs of serious health issues that need your attention. Mistake 3. Ignoring nail care. Take a moment to look at your fingernails and toenails. Are they neatly trimmed and clean underneath? Do you notice any changes in color or texture? This may not just be a cosmetic issue. It could be a sign of your overall health. Dermatologists at the American Academy of Dermatology say that changes in nails can indicate over 20 different systemic diseases, ranging from anemia and thyroid issues to heart disease. Their research shows that in patients over 65, nail abnormalities led to the diagnosis of previously undiagnosed internal conditions in nearly 30% of cases. A clear example is the case of Beatrice, an 82-year-old woman. Beatrice didn't think that her thickening, yellowing toenails were a serious problem. She simply stopped wearing sandals and hid them in closed shoes. "I just figured it was part of getting older," she shared. But when she finally saw a podiatrist for foot pain, the doctor immediately diagnosed a fungal infection in her toenails, which revealed her severely suppressed immune system. Further tests uncovered a serious underlying condition that required immediate treatment. How to fix it? Trim your nails regularly, straight across, with slightly rounded edges to prevent ingrown nails. Keep them clean and dry, and wear breathable footwear. Change your socks daily, and never ignore any changes in nail color, texture, or thickness. These aren't cosmetic issues. They're potential warning signs. Your body is trying to tell you something important. Mistake 4. Improper incontinence management. This may be the most shocking hygiene mistake because of how common it is and how many seniors try to hide it. Over 50% of seniors silently deal with some form of incontinence, but what's truly shocking is how many hide it instead of seeking proper treatment. Urologists at Johns Hopkins Medicine report that untreated incontinence can lead to dangerous skin infections, falls, social isolation, and can even mask serious conditions like bladder or prostate cancer. Their research shows that seniors who properly manage incontinence issues have 60% fewer complications than those who try to hide the problem. Douglas, a 73-year-old retired accountant from Arizona, is a prime example. Douglas was too embarrassed to discuss his occasional leakage with his doctor. He used paper towels and changed his clothes frequently, thinking he was managing the problem. When he finally sought help after developing painful sores, doctors discovered an advanced prostate condition that could have been treated months earlier with much better outcomes. How to fix it? If you're experiencing any form of incontinence, never be embarrassed to discuss it with your doctor. They see this every day and will help you find the best solution. Use proper absorbent products designed for incontinence, not makeshift solutions, and change promptly when wet. Most importantly, recognize that incontinence is not a normal part of aging. It's often a symptom of something that needs medical attention. Mistake 5. Ear hygiene errors. Do you clean your ears regularly? If you're using cotton swabs to insert deep into your ear canal, you might be making a dangerous mistake that many seniors make. Many don't realize that improper ear cleaning can cause serious damage to hearing and increase the risk of infections. Studies show that improper ear cleaning is responsible for nearly 40% of ear canal injuries in patients over 65, with many cases leading to infections that could have been avoided with proper cleaning. Take the case of Patricia, a 71-year-old retired librarian from Washington. Patricia regularly used cotton swabs to clean deep inside her ears until she punctured her eardrum, leading to a severe infection that spread to nearby tissue. "I always cleaned my ears this way," she explained. "No one ever told me it was dangerous." Patricia required emergency treatment and suffered permanent hearing damage, which could have been completely avoided with proper ear care. How to fix it? Remember the simple rule. Never insert anything smaller than your elbow into your ear canal. Only clean the outer part of the ear with a warm, damp washcloth. If you feel you have excess wax, use eardrops specifically designed to soften the wax, following the package directions carefully. If you experience any ear pain, discharge, or hearing changes, don't try to handle it yourself. Seek medical attention immediately. Mistake 6. Poor foot hygiene. When was the last time you thoroughly checked your feet? Not just a quick glance, but a careful inspection of each toe, heel, and the spaces between them. Your feet are not just vital for movement. They're a crucial indicator of your overall health, particularly related to circulation and the nervous system. Foot care experts report that improper foot hygiene can be an early sign of serious conditions such as diabetes, neuropathy, and vascular disease. Research shows that regular foot checks can prevent up to 85% of diabetes-related amputations. Take the case of Raymond, a 76-year-old retired factory worker from Illinois. Raymond ignored the dryness and minor cuts on his feet, thinking they were just normal signs of aging. My feet have looked bad for years, he shared. However, when his doctor checked and ordered a diabetes test, Raymond was diagnosed with early-stage diabetes. This early diagnosis allowed him to make lifestyle changes that prevented more serious complications later on. How to fix it. Wash and thoroughly dry your feet every day, especially between the toes where fungus can grow. Make sure to keep your feet clean and dry, particularly in those areas prone to infection. Regularly inspect your feet for any unusual changes in color, texture, or temperature. Wear clean, breathable socks and change them daily. Don't ignore pain, numbness, or wounds that don't heal. If you notice any changes, see a doctor immediately. Mistake 7. Medication-related hygiene issues. If you're taking multiple medications, have you noticed any changes in body odor, sweating, or dry mouth? These changes may not just be a hygiene issue. They could be signs that the medications you are taking are affecting your body in ways you might not expect. Geriatric specialists from the American Geriatric Society report that nearly 40% of adverse drug reactions in seniors first appear as changes in hygiene habits, before more serious symptoms arise. This could be a warning that the medication is causing significant side effects that require your attention. Take the case of Barbara, a 67-year-old retired nurse from Florida. Barbara's unusual body odor was mistaken by her family for poor hygiene, until her geriatrician identified it as a sign of medication toxicity due to the drugs damaging her liver. I was showering regularly and using deodorant, but I didn't know that the smell was coming from inside my body, not from a lack of cleanliness, Barbara shared. After testing, her doctor confirmed that the odor was a sign of dangerous side effects from her medications. How to fix it. Track all hygiene changes after starting a new medication. Keep a simple journal noting any changes in body odor, sweating, dry mouth, or skin changes. Stay well hydrated unless otherwise instructed by your doctor. Report any unusual sweating, odor changes, or dry mouth to your doctor immediately. Most importantly, never adjust your medication dosage without medical supervision, even if you think the medications are causing these hygiene issues. So now you know the 7 hygiene mistakes doctors easily spot in elderly patients, and more importantly, you now have simple solutions to fix them right away. By making these changes, you not only protect your health, but also maintain your independence and quality of life in your golden years. Remember, personal hygiene is not just about appearance or social courtesy. It's a vital part of maintaining your health. These small changes can help you avoid serious health conditions and potentially add years to your life. If you found this information helpful, don't forget to hit the like button and share this video with your loved ones, especially those over 60, so they can also improve their health and protect themselves from unnecessary risks. Leave a comment below if you've experienced any hygiene-related health issues and share your experience with the community. Also, don't forget to subscribe to get more helpful health videos in the future.